Well, welcome everyone. Thank you for taking time this afternoon to join our celebration here in the Southeast region. My name is Ed Yauk. I am the president of the American Heart Association in the Southeast region. I work with the American Heart Association on the Stroke Systems of Care Advisory Group, as well as the Quality Certification Science Committee, and serve as the Chief of System Research here in lovely Asheville, North Carolina, and Mission Health. I want to thank all of you for both participating in this, but more importantly, doing what it took to be recognized today and be participating in the American Heart Association quality programs and your commitment to overall quality stroke care. What's important is for you to celebrate this with those who made it possible. So if you have members of your team that are not on the call today, please go back and share them the recognition that you're receiving, and also share it with your community. This is a team sport, and it really reflects a lot of effort. So be sure to go back and celebrate and share the credit that is deserved by all of you. The other thing that I'll emphasize is I would encourage you to use social media. Over the next 20 minutes, you'll see your hospitals appear on the banner, and make sure that when you see it, you hit the applause button to recognize your contributions, and then also use hashtag AHA Stroke Impact. It's some tool called Twitter that apparently my children tell me is important, but please go back and disseminate your success with your community at large. You deserve a lot of credit, and once the word gets out, it tends to foster even further engagement. So please continue to celebrate this achievement, and congratulations on this achievement. I'm going to touch on, I'll give a couple of vignettes today. We're first going to hear from Dr. Ralph Sacco. It is my absolute pleasure to introduce Dr. Sacco, who is a colleague and a friend, a true leader in the field who really deserves no introduction, but I will tell you that he is the current chair of the Miller School of Medicine in neurology. He's the past president of the American Heart Association. He's the current editor of the journal Stroke, and he's also the creator and head of the Florida Stroke Registry. So without further ado, Dr. Sacco, it's my pleasure to welcome you to the stage.
Great. Thank you very much, Ed, for that kind introduction. Can you hear me? Let's be sure. Okay. I hope everybody can. So it's really wonderful. First, congratulations to all of the centers, hospitals being listed on the screen for your great achievements across the Southeast, and all of these awards, well deserved for the work that you do to raise the bar for stroke care in your region. It's also great to see so many Florida hospitals listed there, our colleagues and friends that have been part of the Florida Stroke Registry. So I have had the pleasure to direct the Florida Stroke Registry as executive director, and really it is built on the really foundation and collaboration with the American Heart Association, Get With the Guidelines. We started with NIH funding to bring, as a super user group, all of the Florida stroke centers together using Get With the Guidelines. And after 5 years of NIH funding, we used that to leverage Department of Health funding in the state of Florida. So the state of Florida, we advocated, and they wrote into legislation the Florida Stroke Registry, using Get With the Guidelines, and the University of Miami helps digest it, the data. One of the key areas of focus, and thank you again, all you Florida hospitals have been part of this, has been quality improvement, that quality improvement loop, but also reducing stroke disparities. You heard from the CEO, Nancy Brown, about health equity. And we all know that the more you practice evidence-based medicine, our data and other data has shown the lower the disparities between African-American, white, Hispanic, men, women, and even across regions. So we created these disparities dashboards that each of our Florida hospitals see, and then we've created some educational interventions to really help everybody share best practices and then raise the bar across the whole state for the quality of stroke care. I'm happy to say that we are now having our 10th year, hard to believe, 10 years for the Florida Stroke Registry, and even longer, obviously, for Get With the Guidelines. It has truly been a collaboration working with all the hospitals, and we are now up to 160 hospitals that are in the Florida Stroke Registry. All of them Get With the Guidelines. many of them comprehensive or acute stroke ready or thrombectomy capable hospitals that are proud members of the Florida Stroke Registry. We are in year 5 for state funding to keep the registry going, and I'm happy to say year 1 of a Paul Coverdale state. We leverage the support of the AHA and the Florida Stroke Registry to now become a Coverdale state. Many of you know there are about 13 Coverdale states in the United States. These are states that are really focused on improving quality of care for stroke, and they get extra funding from the CDC. I think in the Southeast, I know of at least Georgia that's been a Coverdale state for a while, and we're a newbie as a Coverdale state. But I know there are many others out there, 13 right now. And Coverdale will then improve across the continuum, bringing more EMS data and transitions of care post-hospital data to really improve the quality of care across the continuum. We are really excited to start that work. And as I said, we're in year 1 of that. So many of the Florida hospitals that are listening, we're trying to get you signed up to collect some of the Coverdale measures and to get you recognized for being a Coverdale center, as well as a gold or silver, gold plus, bronze, AHA, get with the guidelines and more center. All of this is really showing how dedicated you are as a team to improving stroke care. Across the state of Florida, we've seen the utilization of TPA go up tremendously. The amount being treated within 45 minutes or even door to needle time in 30 minutes is going up. And now, obviously, with our comprehensive stroke centers, endovascular thrombectomy is also on the rise, all following evidence-based guidelines. So we're really proud of what you all have done. I wish we could all be in person celebrating like the old days, but hopefully in 23, I think it's in Dallas, we'll be hopefully at the International Stroke Conference. And I proudly remember those celebrations when we would take pictures and celebrate all your achievements. I look forward to seeing you, hopefully not too far in the distant future, but continue your great work. I know it's been challenging during COVID, but it really has been terrific to see the quality of care continue and the reduction and the stroke disparities and the improved health equity. Thank you. Congratulations, and stay with Get With the Guidelines and continue to improve the stroke care throughout your regions. Congratulations again. Thank you. Back to you, Ed.
Great. Thank you, Ralph. It's always invigorating hearing your stories of success down in Florida. So thank you for all that you have done, past, present, and future. It is now my pleasure to have another just invigorating discussion. We're going to hear from Dr. Shanti Coleman. She is a stroke survivor. And, I think when we hear stories like this from a healthcare professional, no less, it really embodies today's theme of being relentless and tenacious. And when you hear these stories, you see how well she's doing and how she's being impactful, it really gives us our why. So, Dr. Coleman, it's my pleasure to have you participate today, and we look forward to hearing more from you.
Thank you, Ed. I appreciate everyone for allowing me the opportunity to come and speak in regards to stroke and speak from not only a healthcare professional's perspective, but also a patient's perspective. First and foremost, congratulations to all the healthcare facilities that have been awarded and have shown that quality impact and care as it pertains to stroke patients. Specifically want to give a huge shout out to the 2 facilities here in Memphis that cared for me during my stroke, which is Baptist Memorial Hospital East and Methodist University. A big thank you to all the healthcare workers that provided the care for me to rehab and get through my stroke. Actually a 2-time stroke survivor. In 2017, I had my first incident. Traditional textbook symptoms. I was just talking to my husband in conversation. I started having numbness and tingling down my left side. My speech became slurred, and then my coordination went. And knew I was having a stroke at that time, reached for the phone and called 911. Unfortunately, she could not understand me because of my speech. So my husband was able to take the phone and get the ambulance and EMT to me in a timely fashion. I was then taken to Baptist Memorial Hospital, where I was worked up completely. I had no real health risk factors besides being African American. So I had no diabetes, no hypertension. They really couldn't figure out what was going on with me, and literally were scratching their heads trying to figure out how a 37-year-old could even be having a stroke. I was healthy, had just lost 16 pounds. I don't eat red meat. I don't smoke or drink. So really, it was perplexing to them as to why I was even having this stroke. Well, after a battery of tests, it came back that it was the birth control pills that I had switched to a month prior. So the birth control pills were the cause of my stroke. I was able to get great care at Baptist. I was able to get outpatient rehab in addition to inpatient rehab. And I was sent on my way. I started advocating and working closely with their local Mid-South chapter, American Heart and Stroke Association. And as I was just going about my day, 2019, I started having similar symptoms, headache on the right side. And that's how my initial symptoms started. I failed to mention that. Headache on the right side, and it was just radiating down to my right side of my neck. Went to the same hospital, and I was discharged with migraines, but my symptoms persisted. So I went to another healthcare facility where I was received additional testing and a Doppler, where they found a torn artery on my right side, a torn carotid artery, and a blockage, a 50% blockage. So I ended up having an endarterectomy. And ever since then, I have been fine. Praise the Lord. I've had great support from my healthcare providers and my family. And that prompted me, like Dr. Saka said, about the disparities as it pertains to stroke and minorities, and that really propelled me to do my research in my doctoral nursing program, where I did stroke prevention in African American women ages 20 to 40 who were on birth control pills. And I found a lot of great research and information, and doing that research and implemented an educational tool where it was noted that a lot of those women who were healthcare providers were still lacking that information as it pertains to stroke and oral contraceptive use. So I'm very appreciative to have had the stroke, because it propelled me to do more things in addition to advocating for stroke patients. And I'm very appreciative to be able to continue to tell my story with others. And again, thank you all so much for being such great healthcare providers and continuing to fight and provide the quality of care and improving through research and evidence-based practice. Back to you, Ed.
Great. Thank you, Dr. Coleman. And please, again, we need to be applauding, because this is just an inspirational story. And it really, again, you brought up so many important points of knowing the signs and symptoms of stroke, knowing to call 911, knowing to advocate for yourself and your loved ones. And when you think you're having a stroke, so that was inspirational. And again, I think it just highlights so many of the important aspects of what we need to teach our communities. So thank you so much for joining us today. Now it's my pleasure to introduce Jeremy Beauchamp, who is our Executive Vice President. And unfortunately, Jeremy's unable to join us today, but he does have a video recording that I think we're going to play next. And there we are.
Good afternoon, and thank you for allowing us to celebrate with you today. We're honored to have you with us as we recognize our Get With The Guidelines Stroke Award-winning hospitals. The award you receive today reflects your consistent application of the latest scientific treatment guidelines, resulting in better patient outcomes and quality of life for the people you serve. I'd like to extend my gratitude to each of you. Because of your work, your patients have more time to celebrate priceless memories with their families and loved ones, doing the things that they enjoy, being with those that they cherish the most. In the last year, your focus on quality patient care enabled you to overcome the ongoing and unique challenges created by a global pandemic. Thank you for keeping the health and well-being of your patients at the forefront. You are our heroes, and today's event is just one small token of our humble appreciation for you and your teams. Today we celebrate with you, and when this ceremony ends, we know your work continues. Thank you for the relentless pursuit of a world free from the effects of stroke. Congratulations on your achievement, and I look forward to seeing each of you back here next year. Thank you.
Great. Thank you, Jeremy. Again, I would like to thank all of you for taking time today to join us. This is a time to celebrate, a time to really recognize those who do so much hard work day to day to participate in these AHA quality improvement projects that we know are incredibly impactful to the patients that we serve. And as Dr. Sacco said, it's very tangible, the benefits of these projects in terms of numbers of patients being treated, the efficiency with which we're treating them, and then it follows into the recovery phase as well. So thank you so much for all that you do. Please go back and share the credit, share the awards with all those who really made it possible, and then magnify your recognition. Again, this is all about getting out into the public, both your internal customers, if you will, at the hospital, but as well as your communities. So again, hashtag AHA Stroke Impact. Use that Twitter device that's out there. Use whatever means you have for communicating the great work that you're doing, sharing photos. And again, look forward, as Dr. Sacco said, our 2022 awards will be announced in June. And so I'd like to think that all of you will be recognized again, perhaps even for a higher level of achievement. But for all that you do, and on behalf of the rest of my AHA colleagues, thank you so much. Your impact is immeasurable, and you all deserve an incredible amount of credit for your activities and hard work. So thank you again for joining us today, and be safe.